Hello and good afternoon. This is Elizabeth Hardig with the American Planning Association. Welcome to our Plan4Health peer call. It's just about 12 o'clock, so I'll give folks another minute or so to hop in the webinar room. If this is your first Plan4Health peer call, we are recording the call and it will be available on the Plan4Health website. We also have a fairly small group, only about 15 of us or so feel free to unmute your line if you'd like to ask a question directly to our presenter today. And of course, we have the chat box on the right side of your screen. So if you haven't been spending every moment of every day on the Plan4Health website, we have made some updates and improvements, so feel free to check that out. And of course, the purpose of our call today is to learn more about the Pedestrian and Bicycle Information Center, and there's a link to that in the chat box as well. All right, so I'm excited to introduce Dr. Laura Sandt. So Laura has been with the University of North Carolina's Highway Safety Research Center since 2004, and she's active in a variety of research areas, including intervention evaluations and studies focusing on pedestrian and bicycle safety and other modes of travel. Her primary focus area lies in conducting research and developing guidance related to pedestrian and bicycle safety and mobility, which is, of course, why she's here today, a perfect fit for Plan4Health. And Laura also serves as the director for the Pedestrian and Bicycle Information Center. So we'll learn more about that, of course, but it's a federal clearinghouse of pedestrian and bicycle-related training materials and resources. So we are so excited to have you with us today, Laura, and I will go ahead and turn things over to you.
Thanks, Elizabeth, and I'm really happy to be here and to be able to learn more about what the local coalition members are doing with Plan4Health. We thought this might be a really good opportunity just to introduce you more to some of the services and activities that PBIC provides and see if there might be a way that we can provide additional support for what you're doing, or learn from you and see if maybe there's some further opportunity for collaboration. So I'm just going to tell you a little bit more about our center and kind of give you a little insider tour of our website and some of the products that we share. And just a little bit of background, we are operating from a cooperative agreement that has been provided to UNC by the Federal Highway Administration. They first awarded us the funds starting in 1999, and just a month ago we were awarded another competitively bid award for 5 more years. So we've got a long track record, and we're continuing to evolve and kind of change the scope of services that we offer to meet the needs of our constituents. But our mission has pretty much always been the same since 1999. We are aiming to improve the quality of life in communities by helping to increase safe walking and bicycling as a viable means of transportation and physical activity. So I think there's a very clear connection to health and injury prevention that you all may be working on as well. The goals that we have in the now and in the upcoming 5 years are to really continue to cultivate a network of informed practitioners. We work a lot with engineers, with planners, and increasingly with the public health community, as well as law enforcement and educators. And so we're trying to make those connections and foster engagement at all levels of government and the advocacy community. In particular, we're really working right now at a lot of state DOTs, trying to help provide technical assistance to increase what we understand to be the best practices for planning for ped bike safety. We're also working at the local and NPO level. And through the work at those different levels, we're monitoring trends and issues and trying to provide the best evidence-based guidance that we can through our website and other communication mechanisms. Another aspect of our work is to help support FHWA's strategic agenda. They just released that in September, and some of that revolves around building capacity, providing data and policy guidance to help increase safety, increase the number of pedestrian and bicycle trips, promote equity, and help generally build safer and more complete networks of facilities for walking and biking. So we're supporting them in that effort. and ideally trying to provide information on all of what we call the E's. That's education, enforcement, encouragement, sometimes emergency management, equity, and as well as engineering issues. And certainly, policy and planning are other issues that are key, even though they don't fit necessarily as easily within our E framework. So these are the 4 areas that we work on: providing data, information, research, and policy guidance, as well as offering capacity building and training, and kind of doing a little bit of outreach to help disseminate some of the new and innovative best practices. And so I'll go through this a little bit. Our website, I would say, is the key place where in the past we have stored data, information, and research. We are working now on getting a little bit more of that kind of administered through some of our social media, and I'll talk about that. But our website is the place to go to find case studies, white papers, and other resources. And I'll give you just a quick tour here if I can jump over to the actual website. So our homepage, if you haven't visited it, it's at pedbikeinfo.org. This main section here is where we house kind of the most recent things that have come out. So you can see the strategic agenda. There's a new guidebook that we've worked on recently for developing separated bike lanes, and another guide that came out recently about developing multimodal networks. So you can click through those and see what's there. We also have a feed if you're not able to access Facebook at work. We have a feed where you can see some of our more recent Facebook posts. Under the data and resources section, this is where you might poke around to find some case studies or kind of inspirational stories related to health. If you go, you can click on health, or you can click on planning or any other topic of interest, and you can search and see what might come up. I know some folks are really interested in working on Vision Zero. Here's a link to our equity paper. Within that equity paper, we have some case studies about how actually health departments are working with planning entities to identify vulnerable communities and use data to help promote more equitable distribution of some of their planning ped bike resources and facilities. You can also click on any of these and see some of the local stories that are happening. Heritage trails that are being developed. Here's one on HIAs for the Atlanta Beltline. And most of the case studies follow a pretty simple outline where they describe the problem, the background, and solutions and results, and then a link for more information. And you can also click on them and download them. So we see the case studies as a tool that we provide where people can get a quick, actual, real-world story, and they can download it and take it with them and share it with others if they're thinking of replicating a similar process, or they want to use the results and talk a little bit more about some of those issues. So those are our case studies. The white paper series is another big element of the work that we do, and we put out a few of these each year. Here's one that was about kind of a 101 to using health impact assessments to evaluate ped bike plans. We have others about just understanding high visibility crosswalks, crowdsourcing data. There's just a real range of topics that we address. And the most recent one that we are just about to announce, or just did announce yesterday, I think, is actually one on improving connectivity when you're retrofitting bridges, so that you can provide a better space for pedestrians and bicyclists on bridges, because that's just a really key opportunity that doesn't happen that often to make those connections. So those are just a few of the white papers that we have. We also have a section on frequently asked questions. A lot of these are aimed more at the general public if there's questions about safety, but there are some health-related questions in here. We also have this section on state-by-state resources. If you're looking to connect with your state ped bike coordinator, you can click on any state and see who the state coordinator is. Sometimes there's also the TAP coordinator. That's the person who handles the Transportation Alternatives Program funds. And very soon we'll be adding the Safe Routes to School coordinator to this list as well. So we also, in this data and resources section, we have fact sheets, and there's one on health benefits. We have a whole series on different benefits of walking and biking, and that's really used by a lot of our constituents who are just trying to make the case, sometimes to their local electeds or decision makers about the importance of walking and biking for health and for other reasons. So sometimes those are a hidden resource. This community section of our website, this is really aimed for folks who want to understand the problems in their neighborhood and address safety, or maybe look at things that they can do personally to improve safety or start walking and biking more often. The planning and design section is aimed more at the practitioners in transportation departments that might be actually trying to collect data or analyze the performance of their roadway. We have a whole section on sample plans and policies and funding, which is always one of our biggest issues, and connecting to transit and other facility design issues. In this section, we have all of our webinars and trainings that we offer. One thing to note there, everything is archived, and you can see what's coming up and what we've had in the past. We have a lot of topics that we cover on different issues, but then we also do series. So we've had a series on health issues. We've had a series on designing for safety, and this was an 8-part series where we talked through specific safety treatments. And we had a 7-part series where we looked at different bike facilities, on-road and off-road trails and facilities. So those are, I think, a really useful thing that you can go through the archived webinar or just kind of scan through the slides and see what you can pick up from those web-based trainings. And we are planning on offering those monthly from here on out for the next 5 years as well as part of our new contract. And then programs and campaigns, this is where we have information on those other E's like education and law enforcement and encouragement. And we'll be working on kind of enhancing some of the resources in this section in the next year as well. So getting back to the presentation, I guess in addition to our monthly webinars, we do offer on-demand technical assistance where you can email us or call us with a question, and we can help put you in touch with an expert on our team that we think can address the question, or maybe there's a resource we can help you find. We also offer in-person training and are working on facilitating some peer exchanges. And we provide support to those state coordinators that I mentioned are listed on our website. So just a sampling of the courses that we have taught in the past and can offer. We have a training course on safe routes to school. We have trainings that we offer at the university level to students that are in engineering and planning and public health programs. We have some training on counting pedestrians and bicyclists, as well as we've done a long series on implementing complete street programs and policies and creating livable communities. And we're going to be working on a few new resources that show some of the work we've been doing to train law enforcement on best practices for understanding and I guess implementing the pedestrian and bicycle laws that are designed to promote safety. So if you want to continue to follow us and learn what we're working on and what new resources we're putting out, we do have a quarterly newsletter that's kind of a digest every 3 months. If you go to our homepage, there's a sign up for newsletter at the bottom, or you can go to newsletter/sign up. We also are getting pretty active with social media. We post several times a week on either Facebook or Twitter using the handle PedBikeInfo. And we go to between 5 and 10 conferences per year, so we'll very likely be at the APA conference this year, as we have been in the past several years, and others. So we'd love to talk to you if you're there, or if we want to arrange any other time to collaborate. So I think that's all I have, unless anybody has specific questions or wants me to go back into anything else in more detail. But my information is there on the slide as well.
Great. Thank you so much, Laura. That was a fabulous tour of the website. I've been on the center site many times, but it's nothing like having the creator walk through what you have available. So that was really helpful. Folks are welcome to ask Laura questions directly or type questions into the chat box. One item that I was actually chatting about with a colleague earlier, or must have been last week, was the report you mentioned on equity, and just hearing you talk a little bit more about that and the case study with health departments and using data to really identify more vulnerable populations is certainly the spirit of Plan4Health, and I just wondered if you could talk a little bit more about that particular case study, or if you...
Yes, the one I was referencing was from Humboldt County, and I'll open up the equity white paper real quick. So the equity paper, we published this in April, and the intent behind it is to really just, the first section of the paper lays out some common terminology, and this is huge. Let's see if I can make it a little smaller. But we kind of define some of the transportation concepts, related to equity within the framework of pedestrian bicycling issues that we're looking at. And this was very much based on FHWA's definitions and policies that they're using internally. So I think it's a little bit different than some of the language and terms that are used by other groups, particularly more of the advocacy-oriented groups. But we compiled some of the research background about the equity-related issues, and then we really tried to dive into actual things that can be done to help address equity during the process for planning pedestrian and bicycle improvements. And so the one that I mentioned was, I think it was towards the end, where we're talking a little bit about using data to understand the equity issues. And let me get down to it. So Humboldt County, California, so this is the one, I guess it starts on page 19. I think it was a process that was very much driven by a partnership between the public health and the planning folks in the county. They tried to really understand where their equity concerns were by mapping them and gathering and analyzing as much information as possible, identifying kind of hot spots and how those might be affected by future infrastructure projects, and then developing a plan around that. And so the Humboldt County Transportation Disadvantaged Populations Report, we link to it there in the white paper, but I think that's just a really nice model of kind of the partnership and the use of data that came together to help inform a plan.
Great, thank you for opening that up and showing us that report. That's really helpful. Oh, great. There are a couple of comments in the chat box. One shout out from John, just a thank you for creating and maintaining this robust resource. He found it to be very helpful and informative.
Oh, great, thank you.
Yeah. And then another shout out from Kate, saying that she appreciated your willingness to share these resources, and just letting you know that folks in the public health field are really excited to be working with multiple sectors across sectors to advance health equity through active transportation, which is wonderful.
Yes, and we are too. And one of the things that we're currently working on now, because we did just receive 5 more years of funding, is we're kind of mapping out our work for the next year and trying to really understand the needs that haven't been met by our past resources and content. And so we welcome any feedback if you have ideas that you would like to suggest for webinars or gaps on our website that you think need to be filled, or content that you're really looking for, or even problems. We understand one of the biggest challenges with our site is that there's actually so much content, people have a hard time finding it. So we're always looking for feedback on terminology that you would use to find these resources and how we can improve the structure to help people navigate and find what's most useful to them. And so I really do welcome any feedback on tools and ways that we can improve our work moving forward.
Great. I certainly hear you. I feel like the Plan4Health website gets larger and larger every day, and sometimes it can be a little bit challenging to find exactly what you're looking for, and things get a little bit buried. But I do think the white paper versus case study versus fact sheet is certainly a nice framework and helpful.
Great, thanks.
We do have another couple of comments referencing the APHA conference last week in Denver. I know many folks who are on the line were probably there. And it sounds like there was a lot of interest in the PBIC sessions in particular. And Kate is mentioning that she will brainstorm with members, especially the physical activity section and the environmental health section, for feedback and recommendations around tools and webinars, which would be great. And we could also send out.
That would be excellent. We have attended APHA in the past. PBIC did not have an exhibit booth this year. But that is certainly a great forum for talking about these issues more, and we do want to keep following what the conversation is at APHA and other conferences like that. Mm-hmm. We have on our website a list of upcoming conferences and events too, and that's also in every newsletter that we put out, so you can always see what's coming up in the future. I know there's a couple of events that are focusing on equity issues in the near future. So you can also kind of find out what conferences are coming up, and what we're trying to do too through social media is, even if we can't attend a conference, if we can use that conference hashtag, we can provide some of the updates and highlights of each of those events through our Twitter feed.
Great, that's fabulous. I know we've definitely been using hashtag Plan4Health over the last couple of years, and it is nice to be part of that larger conversation. We do have a question from John, just asking about the biggest challenges that you might have faced in developing collaborations between public health and planning and other folks.
So, I mean, the PBIC is a little bit more at the national level, but I personally have worked on some projects that are at the state and local level. And I think, and I'm specifically talking about projects that have happened in North Carolina that we've been involved with. I think there is a growing convergence of work in that area, but one of the biggest issues is just trying to identify where the opportunities to collaborate are, because I think we've been operating in these silos for so long, that the planners have their processes and their specific roles that they are following, and then the public health community is also, they have the things that they're working on, and we haven't always found those opportunities to connect. So I think in North Carolina, there's a lot of cross-pollination happening around Safe Routes to School now. Our state Safe Routes to School program includes funding that they've gotten from the Department of Health Services that funds regional active routes to school coordinators across the state, and they help support some of the local Safe Routes to School programs. So that partnership at the state level is also helping drive collaboration more at the local level. I think that's been a real opportunity. I think the other opportunity area that we're seeing is around Vision Zero, where planners and engineering departments are waking up to the resources that the public health departments have in terms of surveillance and injury prevention efforts. And so I think in big cities like San Francisco and New York, it's really the public health departments that are taking the lead in identifying the issues and then working with the planners on coming up with a little bit more holistic approach to addressing those issues than they might have traditionally done just through planning or engineering alone.
That's great. And not to put you on the spot, John, but John is part of the Plan4Health cohort, in the first cohort in the coalition in Iowa, and they've really done a fabulous job of building some of those initial partnerships, and I think have found that working at both the state level and the local level, things kind of feed together, and there's been a lot of great energy. Vision Zero in particular has come up with, well, in both cohorts, but I'm thinking of a couple of examples in cohort 2 out in California, in the Sacramento area, where it's not directly part of Plan4Health, but it's certainly connecting to the work of the Design for Active Sacramento Coalition. And it's been great to have those just complementary policies and projects going on at the same time.
Great.
Well, great. Well, we do have a few minutes left. If other folks have any questions, or if you'd like to share a little bit about the work that you're doing in your community, I'm sure Laura would be interested to hear all of the great activity that's happening, or maybe some challenges you might be facing right now. We can think through some resources or ideas together. I think what's been nice with cohort 2 is we have some more established coalitions who have been working across sectors, who have planners, public health folks, engineers, but we also have our capacity building track this time around. So we have 5 coalitions who are really just starting to form relationships and really just starting to bring folks together around healthy communities. And I have to say, I think I regret not sending out your fact sheets earlier, because I do know that when some of our coalitions were starting to bring in new partners, really being able to make the case in a clear, accessible way, and taking advantage of some of the research that folks like you have already conducted is so important to get that early buy-in.
Yeah, that's a big issue for sure.
Well, great. Well, maybe if you wouldn't mind putting up your contact info one more time, just so folks could write down your email address. And thank you so much, Laura, for being on the line and talking through all that you have to share. And we'll certainly post the information on the Plan4Health website and make a point of sharing your newsletter as well. It just seems like there's a lot of opportunity for future collaboration and potentially joining your webinars, your training events, I think would be really wonderful.
Absolutely. And, I think it's coalitions like the ones that you guys are all working in that we learn from the most, and that we can develop these case studies and help share with others. So I really value the work that you're doing on the ground and hope to continue following it. Thank you.
Great. Well, thank you, everyone, for joining us. And we'll be on the line for just another minute or two if you have a question that maybe you didn't want to ask in front of everyone. Otherwise, have a wonderful afternoon.
Thank you.